If I were to ask you, what steps would you say were part of the brief negotiated interview, and was it all?
Okay, and what parts were more like the MI that we discussed?
More like the MI, the four processes
It's important to know that MI and the BNI, the brief negotiation interview, are different things. They're very, very different, but there's a lot of overlap as well. So with the BNI, we have 4 steps, and that was actually initially developed by Drs. Stephen Rolnick, Ed Bernstein, and Gail D'Onofrio, with whom I work now. The first step is to raise the subject and ask permission. So that's kind of our engaging step. So back in whatever it was, 95, 96, they laid out these 4 steps. That was the first one. The second one is to provide feedback, is to zero in on the main concern that the physician is having and to give some neutral feedback, non-confrontational, about the downsides of that behavior and about what our recommendation might be. And it's funny how analogous it is to the new conceptualization of MI, where you're now focusing in on something. The third step is to enhance motivation, which uses, again, the motivational strategies we talked about before, evoking the patient's own reasons for change and reflecting on those. And finally, it's to negotiate a plan. So it fits very nicely,
Yeah.
I think.
It's very similar, and in fact, they really do seem to work well together.
Yeah. Right.
So let's see those get put into practice.
Okay.
I know you do it so well. I had an opportunity to see you do it before, so I'm looking forward to seeing it now.
Hi, Monica. I'm Dr. Pantalone.
Hi.
Nice to meet you.
Nice to meet you.
So I understand your doctor that you just saw for your hypertension wanted us to talk a little bit.
Yes.
Would it be okay if we talked about your use of alcohol?
I really don't see what the point is.
It's hard to see how it matters
Right.
at this point, yeah. We don't absolutely have to do that. There may be some value, but only you can decide if we do that.
I mean, is this going to take very long? Because,
10 minutes at the most.
all right, I just don't understand what the relation is.
Right, and there may be a connection, there may not be. I can only go by what I see from your doctor and what you've reported. But I have to say, to start off, it sounds like you've been through a lot recently, and I'm sorry to hear about the troubles you've had. Can you tell me a little bit more about it?
I mean, I lost my job, and my husband and I just keep fighting. A lot of it's about financial issues, and my 15-year-old son just got kicked out of high school for pot possession.
I'm sorry. That is a lot. Yeah, I don't blame you for being stressed.
Yeah.
Yeah. Okay. And so the last thing you want on top of that is somebody to grill you about your alcohol use.
Well, obviously I'm under a lot of pressure, and if it's hypertension, which is high blood pressure, there you go. That's it.
That makes sense. Yeah. Yeah. So job, relationship, and your son, I wouldn't blame you for not wanting to spend extra time on this. But I guess I was wondering, as it's the case for some people, is if there's a connection between the medical stuff and drinking and how some of these things, at least. I'm not saying that they've caused it, but could you see any connection?
I've always had a drink or two at night. It relaxes me. Just a glass of wine, and just the past couple months, it's just been so much that, yeah, I've had a couple more. It's not that big of a deal.
Again, one or two doesn't raise my concern. 4 or 5 does. So again, I'm not saying that you have a drinking problem, that you're an alcoholic. I'm not saying that at all. But one of the things we know is that for a woman your age, drinking beyond 7 drinks a week or more than 3 in a given occasion, say about 6 hours or so, puts you in a risky category.
But it's just at the end of the day. It's not like it's during the day where it is affecting my work ability or my productivity ability. I mean, everything. I'm a highly functional person. This is just a couple drinks at the end of the day because I have a lot going on, and it helps me relax. It helps me sleep.
Sure, I know, I understand, right? But if I could show you, 1 glass of wine is about 5 ounces, has the same amount of alcohol as liquor in say, a shot, 1.5 ounces. 12 grams of alcohol, 12 grams, 12 grams. So if you drink 4 or 5 glasses of wine, it's as if you had 4 shots of liquor.
But isn't red wine healthy?
Well, 1 glass a day could be. But I hear you saying that you're drinking in response to the stress. But it does seem that the drinks increased. They've just about doubled. And even though you're functioning well in most areas, you did report to your doctor that you kind of passed out in the bathroom one night. That was a little concerning.
That is not typical. That was one night I had a shot or 2 or just a couple shots of Sambuca along with the wine, and I actually had, I don't know, I guess I finished a bottle of wine that night. So, I mean, yeah, it was just it wasn't normal.
Right.
And it's not like I do that all the time. That was just extra, and I won't do that again. That's
That's not typical.
No.
That's not you, and I think we've found some common ground here where you don't want that to become you.
No.
All right. And I believe everything that you're saying, and we could be too concerned for something that is just happening in this moment in time, and it could all go away tomorrow. So I'm not saying you're doing anything wrong or that this means you have a big problem. And in fact, what I'm saying is that this is risky. Doesn't mean you have a problem, or like I said before, doesn't mean you're an alcoholic, but risk begets more risk, and it could increase. That said, it's up to you what you do with this information. It's totally your choice whether to continue the same way or think about doing something different. But I guess my best recommendation would be to see if you could bring it down to what we call low risk limits. No more than 7 drinks, the standard drinks that I just described, a week, and no more than 3 on a given occasion. So Monica, given all of this, if I were to ask you, how ready might you be to give this a try, to try to reduce your drinking to those limits that I talked about? How ready might you be? Say on a scale of 1 to 10. 1 means I'm not ready at all, thank you, but I'm fine the way I do it. Or 10, I'm really ready to try something different.
I don't know, like 4.
Well, that's not nothing. That's 40% there. You could have said 2 or 1 or no, I'm fine. But there is a part of you that may think that this is a decent idea. What part is that? In other words, why didn't you say a 2 or a 1?
My husband, I mean, he's the one that really wanted me to come in here, so, yeah.
So, while you may feel inside of your body and mind you're fine, things with him aren't. So one thing I'm hearing is that if you were to give something a shot here, like a reduction in your drinking, you might be happy about that. That may make things a little better. Anything else?
And my son. And setting a better example for him.
But how about the benefit to you? How would you feel if you were able, say, to bring it down to no more than 3 in a given day? What would that do for you?
I'm sorry, but I really don't understand how, drinking would lead to, high blood pressure and how this is all related. I mean, obviously, I'm just under a lot of stress. That's all that it is. And actually, if anything, it's probably helping me because it relaxes me and kind of, instead of you know, me being all high strung all of the time. You know, it just helps even me out. So if anything, I would see the alcohol as being a benefit because it relaxes me.
Yeah, but there is a part of you that's wondering, is there a connection? And maybe that is also a little important to you. But imagine you go home today and you say to your husband, I'm not totally into this, but I'm going to give it a try to drink no more than 3 on a given occasion, no more than 7 in a week. How would he react?
He would probably be real proud of me.
How would that feel?
It'd feel really good for the moment.
All right, well, a lot's going on. You deserve at least one moment stress-free. All right, so given what I described could be the next steps in terms of addressing this, what might be your next step?
I mean, I could try to cut down just a little.
Like?
Like 3 glasses a night.
Okay, so I appreciate your thinking a reduction would be good, and you're bringing that down to lower than what it was before, and that's good. However, 3 a night, which suggests every night, would still be 21 drinks a week compared to the 7. That is low risk. I'm not saying you have to do that. I appreciate your working it down, but that would still put you in the high risk category. Is there any way that we could, I mean, 1, is that correct? And if so, could we bring it closer to the 7?
3 smaller glasses a night.
Talking half drink?
I mean, I can do the best I can.
Sure, okay. I entirely respect it. This is your choice. This is up to you. And you can do the best you can and then follow up with your primary care doc and see how it's going. And then between you and him or her, you can figure out what connection actually there is between your hypertension and the drinking. But, you know, I would bring you back to what you were talking about earlier, that the hypertension is not the only possible negative result of your drinking.
And then if after 2 weeks, if nothing changes, then it wasn't the alcohol and I'll be fine.
If nothing changes with regard to your hypertension, then your doctor will have to figure out the other cause or the other, solution to that. But I guess you're also looking to see what will happen. Will things with my husband go better? Will things with my son go better? Will my stress be better? Those are the things to look out for because they are the potential benefits to reducing your drinking. So I think we're in a good place. I think we've come to an agreement of a trial of reducing, following up with your primary care doc, and then seeing what you think there. Nobody's going to make you do something you don't want to do, but I do appreciate you saying cutting down is going to be helpful to me. And I think that's where I think we have some common ground. So I think this is a good move. I know it's hard to do, and I appreciate your willingness. But do you have any other questions?
No.
Okay. Well, I wish you all the best, and thank you for taking the time to talk.
Thank you.